many people do have the concern that can this Balanoposthitis or can this cracks on the foreskin be treated medically? The answer is absolutely no, because these medicines can only clear the infection that is present for that time. But once the antibiotic is stopped, definitely there is no stopping force for this infection to progress. So there will be definitely progress of the infection, because let's put it in another way. If a person comes to us with symptoms of bad odor from him and itching, if you look at his history, he gave a history that he didn't have a proper bath for last 7 to 10 days. So his symptoms can be treated in 2 ways. First thing is to give him a scent or perfume and anti-itching medication, and the second method to treat him is without any medication, ask him to go for a proper bath. Which one would be better? Definitely having a proper bath would be better, because in the first scenario we have treated the symptoms, but in the second scenario we have treated the disease. So once we treat the disease, obviously the symptoms will go off. In the same way, in Balanoposthitis, what is happening? The sugar remains the same and the sources of infection remains the same. So as days progress, there will be worsening of symptoms, but there won't be any betterment of the symptoms. What these people can observe after taking medication is there will be fluctuations. There may be ups and downs, but there won't be any permanent cure for the disease at all, because as we discussed, the diabetic status is going to remain the same and the sources of infection are going to remain the same. But as days progress, what is going to happen is the number of cracks increases, and thereby the number of scars also increases, and the skin tightening is also going to progress day by day. So these people can only be treated permanently treated only with a procedure called as circumcision. So what we'll be doing in circumcision? Only this extra foreskin which is being subjected to urine or semen or female vagina is subjected to infection. So once this foreskin is removed, definitely there is no foreskin, so there is no scope of infection at all, and this is going to be a permanent cure once for all. This is a very small procedure which is mostly performed under local anesthesia only. The procedure hardly may take 5 to 7 minutes of time, and people need not have a fear that once after circumcision, just because they are diabetes, there will be delay in wound healing, because it's a very simple procedure. And if we do a stapler circumcision for these diabetic patients, there won't be any wound at all. So there is no risk of infection or delayed wound healing per se. The only precaution that is needed to be taken after getting the procedure is done is proper cleaning of the wound. What is proper cleaning is, the person needs to make sure that the urine drops are not getting spilled over the dressing over it, but otherwise the person will be able to resume his regular activities the very next day. But there is no requirement for limitation of physical activity or need not take bed rest kind of thing. The person can walk on the same day, can resume his regular activities the same day. It will be performed under a local anesthesia only as discussed, and it's going to be completely bloodless, and it's after stapler circumcision there won't be any stitches also, because after stapler circumcision what all they will be having is a silicone ring that is replacement for the stitches, and this silicone ring is also self-dissolvable. It gets detached by itself within approximately 2 weeks of time, and it gets peeled off on its own, and the end result will be a cosmetically super clean suture or the scar.